All right, guys, this is the final PowerPoint lecture for this first module or first unit. And this one is all about inflammation and infection. And it's kind of an interesting, topic. And there's only, I think, 23, 26 slides, something like that. It's not too bad. And there's a few things in here that are really important for you to know, and there's some things in here that are just general knowledge kind of things, again, that I want you to know, and I'll try to foot stomp those things that are really important for you guys to know. And then, again, like I said, as it gets closer to your exam, we'll have an exam review. All right, let's get this last one of this first unit together here. All right, so inflammation and infection. We have some defense mechanisms. We've talked about this, that our skin is our first line of defense. There are 3 lines that this chapter talks about, which are physical or surface barriers. These are non-specific. Inflammation, again, is non-specific. But our immune response, however, is very specific. And so when you think about this, kind of think about immunizations. So when we get immunized for polio, well, that's probably a bad example. We don't really get immunized for that anymore. But let's say chickenpox. We have a specific immune response to that virus. And so our body is going to specifically respond when we are exposed to that. So that's the specific versus non-specific. Inflammation is very non-specific, right? Because you can get inflammation for stubbing your toe or for a tick bite or for different things. So it's non-specific. Inflammation, again, like I said, non-specific cellular and vascular reaction. It's going to repel and destroy whatever's invading. It's going to clean up debris, that phagocytosis that I talked about, to promote healing. It does require a blood supply, and it's designed to be beneficial and protective. However, sometimes inflammation can cause problems in and of itself, and it can become very intense, very harmful, and very painful. This is part of the inflammatory process here. You don't need to memorize this. You don't need to necessarily know all of this, but we talked about trauma that can release these mast cells and histamine. And histamine, it's just a process there. And when you think about histamine, who in this class has taken an antihistamine? It's interesting how that plays a response in here. And then we can get hyperemia, which causes redness, heat, increased leukocytosis, which are leukocytes, which is our white blood cells. Again, histamine increases our vascular permeability, which increases exudate, which is just that pussy stuff. Exudate is swelling, edema is swelling, pain, loss of function, and phagocytosis, that's what I kind of talked to you guys about, that eating of dead debris or different debris, which creates pus, and macrophages come in there. And you don't, like I said again, don't need to know all of this. This is just a basic overview here for you of the inflammatory process. And most of those words you don't even need to know. Types of inflammation: there's acute inflammation and chronic. Acute lasts less than 10 days, chronic lasts 2 weeks or longer. Let me give you guys an example of this. So I ran over a steel dog cable with my riding mower 2 years ago. 2 years ago? Yeah. And in the days following that, I had a lot of inflammation of my leg. I thankfully didn't lose my leg. It just damaged it pretty good. And it actually was swollen longer than 10 days. But then I have had chronic inflammation of that leg off and on since. And even today, I noticed that it was a little bit swollen. And as time is going on, it doesn't get as swollen now. But the more I'm up on it, the more I'm doing, the more it swells. I've noticed people talk about that, like if they broke a bone or something like that, over the years, they'll just have inflammation in that area. Inflammatory exudates, this is the appearance and the amount of exudate, which is a blood fluid, can reveal acute or chronic condition. A serous exudate is a clear serum-like fluid, and it's an acute state of inflammation. Here we're talking skin blisters, cold sores, things like that. My daughter had a virus one time, I forget what it was called, but she got these little bumps all over her, and it wasn't chicken pox. But when you would pop them, this clear fluid would come out, and then it would cause 5 more bumps to come up in that same area. It was awful. But eventually we were able to get rid of it. Fibrinous exudate, you don't need to know all of these word for word. In fact, I don't know that there's anything about exudate on your exam, but just know that it can happen. But fibrinous, it just is a larger injury with severe inflammation, strep throat, bacterial pneumonia. It forms like a mesh-like lesion. This also includes a superficial scab. This is so interesting. If you ever have time and you want to look up something really interesting, how a scab forms is very, very interesting. Because if you think about it, just over time, you think it's dried blood, but it's not really. It's this fibrinous exudate that kind of, if you put your hands together and your fingers slide together, that's what this exudate is doing. It's kind of just forming this fibrous mesh like over wherever it is to form a scab. It's very, very interesting. Purulent exudate is just pus that can be very gross and smell. An abscess is just going to be a collection of that pus. And empyema is just an accumulation of the pus inside of a body cavity. Inflammatory lesions are due to a physical or pathological injury. And these can include abscesses, ulcers, cellulitis. There are people out there like me who love to see these things. Like there's, what is that show, Dr. Pimple Popper? There's so many things that it can be very, very interesting to watch what the body can accumulate. Tissue repair and healing. This is an ongoing process. It can be slowed by a disease, malnutrition, compromised immune system. I do know some surgeons, not all, that won't do surgery on somebody who smokes because it can compromise their healing and slow down their healing time. Tissue repair, and keep in mind that it can slow down their healing time because, going back to that lack of oxygen that we talked about, you need oxygen for healing, and you're not going to get it to those distant areas, like let's say your toe or your foot. Keep in mind also things like diabetes can impair our immune system and can slow the process of healing and tissue repair. That's why people who are severe diabetics and get like a little rock in their shoe and they don't notice it causes a little sore on the bottom of their foot, and it can spread and they can actually lose their foot over it. It's the oddest, it's not really odd, I guess it's just so weird how they don't have the good nerves in their foot have been damaged, and so they can't feel a lot of that, and so they get this big sore. And I remember one time I was doing some clinical, and I was in a doctor's office, and this guy came in, and he had gotten a rock in his shoe, and they didn't know at the time that he was diabetic, but based on the wound of his foot, and it was in between his toes, and based on that and the fact that he couldn't feel it, they ran some tests, and sure enough, he was severely diabetic, and they were able to not only get him on medications to improve the diabetes, but they were also working really, really hard to help that wound on his foot, because people do lose their feet, toes, things like that. You can have tissue repair. Like I said, that fibrous connective tissue repair, scar formation. There's different types of tissue healing. We're not really going to get into a lot of this, but just that primary healing, it's going to form a scab. New capillaries begin to bridge the gap between the wound edges. A fibroblast is going to grow across the deeper wound layers, and a scar is going to form. It's very, very interesting if you ever had the time to go out and research it. And then there is tissue healing for larger, deeper wounds with more inflammation. These are going to need more capillaries, more fibroblasts, more collagen. And after 1 week, they're going to have new soft red tissue produced, and the scar tissue is going to form. And the healing time is going to depend on the size of the wound and, again, on their nutrition. Do they have any diseases that are going to impact this? And like diabetes, do they smoke? All of those things. And they also want to make sure they clean that wound, or what we would call debride that wound, to make sure there's nothing in it to prevent it from healing. Speaking of, the impediment to healing would be the amount of dead tissue or debris, dirt, bacteria, dead leukocytes, other contaminants. And sometimes they'll go in and they'll debride or clean that wound several times to try to get that to heal well, because they also want the blood to be flowing well to that area so that it can heal properly. And sometimes they'll even pack those areas. If there's like a hole or something like that, they'll pack those too, so that nothing can get in there, and it just helps with the healing process. And then that debridement that I talked about, it's going to speed healing. It's going to they might cut away some of the dead tissue or any foreign material. All right, we talked a little bit about this just a minute ago, but there are different factors that affect healing time. The older we are, unfortunately, the less quick we are to heal. The size of the wound, the location of the wound. Think about a wound that somebody who is immobile and their wound is on their backside. You know, those wounds are hard to heal because you're laying on it all the time. Or a wound on the bottom of your foot, how hard that would be to heal. Your nutrition is going to play a part. Being immobile, like I just talked about, circulation, poor circulation, like with diabetics, people who smoke, things like that. And then by this next one, what that's talking about is how strong is that organism, and how resistant is it to treatment. You think about things like MRSA, methicillin-resistant Staphylococcus aureus. That is very resistant to meds, and so that is going to affect the healing time. And then again, if somebody's on steroids, that also will affect the healing time. All right, poor or excessive scar formation may lead to the wound separating. Dehiscence just means that it separates at the tissue margins. It's not healing properly. There's something called keloid scars. We'll talk about that a little bit later, I think, in the skin chapter. That's just when they get excessive collagen formation. I don't think that that's exclusive to the African American or Black population. Well, actually, I think it is. I don't know that I've ever seen or heard of it in any other ethnicity, but definitely can happen where they will have like a pierced ear, and then they'll get these keloids that will form, and when they take off the keloid, more come back in its place. And then again, we can get adhesions, which is fibrous bands of tissue that attach to the surfaces of adjacent organs as the scar tissue develops. And you remember me talking about the last chapters about my sibling who had a neoblastoma, and actually recently ended up having a tummy tuck that ended up being paid for by insurance, because there were so many, because as a child this occurred, and now as an adult, there was so much scar tissue built up that it was actually had attached to some of the organs and was causing quite a bit of pain. So they had to go in and cut all of that out, and then, you know, reattach everything, and actually got a tummy tuck out of the deal. So it's a pretty good deal. All right, here's dehiscence versus evisceration. That top part, dehiscence means it just separates. You can see right there, but all the organs and everything is still inside. Evisceration is just everything starts coming out of the surgical wound. That's very, very bad. Oh, there's a keloid. That is probably somebody who got their ear pierced, and then a keloid developed behind it. And again, when they go to cut those off, a lot of times another one, sometimes even larger, will form in its place. Infection is an invasion of the microorganisms that cause cell or tissue injury. This can be a lot of times because our normal flora, which is our good bacteria, sometimes can get overrun with microorganisms, but sometimes our normal flora can cause some problems. We think about this sometimes in women who have an infection of whatever sort, and they take antibiotics and they develop a yeast infection from their normal flora, which is normal. Yeast is normal, and then but when you kill off the bad bacteria that you're trying to kill, like a strep infection, let's just say, and then it's also going to kill off other bacteria, and you need a good versus a bad bacteria balance. Otherwise, things tend to overgrow. And so when you kill off bacteria, in some women, yeast will tend to overgrow and they'll get a yeast infection. And so it can be caused by things that are normal in our body. And then pathogenic are just microorganisms causing the disease. And opportunistic are normal flora, like I just talked about, becoming pathogenic under certain conditions. That's just what I was talking about. All right, conditions for microorganisms to become pathogenic: they have to gain access to the body through a portal of entry. Remember, think about our skin as the first line of defense, but they can enter through our throat, through our nose. They can enter through our GI system, like something that we eat. But a lot of times it's through a cut in our skin or something like that. Then the pathogen has to be resistant to our defenses. So think HIV, before we had treatment for that, the pathogen was resistant to all of our defenses and actually used them against us. And then a high number of invading microorganisms, and the vulnerable condition, when they're talking about host here, they're talking about us as humans. So infectious diseases are the leading cause of death worldwide. And I think that that's not necessarily in the United States, but when you think about third world countries and things like that, I'm sure that that plays a factor in that. And it's crucial to identify and track. So that's why we have the CDC. They do that for us. And respiratory infections are the most common. All right, bacteria. We have primary or secondary disease. Staph is a bacteria that's on our skin. And everybody probably has staph on their skin. And when you get a cut or something like that, if you have a weakened immune system, sometimes that can invade, and then you can get a staph infection. There's also streptococcus, which is another bacteria that lives on the skin and in our throat. And sometimes during the perfect storm of things, it can become an infection that we get and makes us sick. And then there's some common enteric bacteria here. These are, when they talk about enteric, they're talking about our GI system, our stomach, our intestines. So E. coli, Pseudomonas, Salmonella, these are all types of bacteria. And then when we talk about, hold on just one second. When we talk about viruses, that's the smallest infective organism. I'm sorry, that was my daughter. And she likes to come in here and interrupt, but she's not allowed. So these are the smallest infective organisms. They must be visualized by an electron microscope. They cannot reproduce or live outside of the cell, and they're not easily treated or killed by antibiotics. And let me say that again, a lot of times when people go to the doctor and they're sick, they want an antibiotic to feel better. And when the doctor or the nurse practitioner says, this is a virus and you're going to have to let it run its course, a lot of times people get very, very upset by that. But when we overprescribe antibiotics, there are lots of bad things that happen, and we get resistance to those antibiotics. And people, not only do we get resistance, that's mainly when people don't complete their antibiotics, but the viruses can change and format to develop against those when they're, the antibiotics are used when they're not needed. So just keep that in mind when you're sick. And I know that because I'm just as bad when I'm sick, I just want somebody to make it better. But sometimes it just takes time and rest. And there are antibiotics to help prevent secondary infections, and that's what happens sometimes. It'll start out as a virus, and we'll get a secondary infection, and then all of a sudden antibiotics will help. There are immunizations that are effective in preventing things like measles, mumps, rubella, smallpox. I'm going to tell you guys the same thing that I told the last class. I'm not getting into the immunization debate. I don't judge people who don't immunize. However, I do, and immunize my children. And but keep in mind that there is a huge debate out there over immunizing versus not immunizing. And I don't know that it does any good to argue the point with people one way or the other, because usually people have an opinion one way or the other. So just try to provide information, and that's about the best that you're going to be able to do. There are latent viruses that lay dormant in cells and can replicate. These can cause symptoms during times of stress. Oh, there's an STD that does this. I just lost the name of it. I'll think of it. Not gonorrhea, not chlamydia. If somebody thinks of it, type it into our discussion board. I can't, probably because, okay, I'll try to think of it. But it's kind of like there's an STD that does that, but there's also the one that causes cold sores, same way, same thing. You don't have a cold sore all the time, but it's something that lays dormant until you get stressed, or your immune system gets impaired for some reason, and all of a sudden, bam, you have a cold sore. All right, fungi are microscopic plant-like organisms larger than bacteria. There's only a few that are pathogenic, and these are so interesting to look at under a microscope. But there's tinea, which is of the skin, and candida, which is a superficial infection of the skin and the mucous membranes. These are treated with antibiotics and antifungal medications. They're often difficult to cure and may require long-term therapy. Rickets is a microscopic organism that are intermediate between bacteria and viruses. These must live in a host cell like a virus, and they're spread by fleas, ticks, mites, and lice. And I say rickets, there is a rickets, but this is more like rickettsia. I don't even know exactly how that's pronounced, but this is a type of infection, and it can cause different things like Rocky Mountain spotted fever. That's the most common, that's spread by ticks. Protozoa is a single-celled microscopic organism. These are found in the soil. They live on dead or decaying material. They can infect through bite of the infected insect or ingestion of the spores. These are also very interesting to look at under a microscope. Malaria would be the most common. Giardia is from infected water. Very, very interesting to see and actually move. It's super interesting. I saw them under a microscope in microbiology at OTC when I took that years and years ago. Helminths are roundworms or flatworms. Pinworms, tapeworms are the most common. Pinworms can cause anal itching, and tapeworms cause intestinal disease due to inadequately cooked meat. This is still around, people. I don't know, like my last class was just pretty grossed out by this, but pinworms still happen. They happen in children a lot, and I've always heard of it like that you do this tape test where they would put tape in their underwear of the child because the pinworms would come out more at night, I guess, and then they would get stuck to the tape and you'd be able to see them. But usually in these kids, from what I've heard, I've never actually seen this, but they'll be scratching at their bottom quite a bit. So testing for infection or symptoms: fever, tachycardia is just a rapid heart rate. Malaise is just kind of laying around not feeling good. Leukocytosis is just going to be affecting the white blood cells. And septicemia, when somebody gets septic, that just means that the infection has went throughout their body. Not good. Being septic is not good. Testing for infection, they're going to test their blood, a culture and sensitivity. I like to talk a little bit about this because a lot of your clients, you guys have probably had this done. A lot of times they do this when somebody is being tested for strep throat or different types of infection. They will take a culture or a swab of that, and then they will put it on like a little plate to see, and then they'll let it grow. And then once it grows, they will put different antibiotics in different areas, different antibiotics in different areas of this little agar plate. And then they will see which one kills it the fastest or kills it at all. And that's the antibiotic that they're going to use. And that's the sensitivity part of the culture and sensitivity. And so a lot of times people don't realize that, and that's why it takes several days, is because they have to let it grow. Then they have to treat it and see which one kills it. So that's why sometimes you might be started on one antibiotic, and then they'll call you and they'll say that antibiotic isn't going to work and you're going to need another one. And then you're going to have an antigen antibody, and your skin is also going to, they may do some testing on your skin too. And that is all for that one. And that is all for this unit. This is the final lecture for the first module or the first unit. And so that is all the information that will be included on your exam. I believe it's chapters 1 through 4. And I will be posting a test review, like I said, when it gets closer. And we will, I believe our first class period is before the exam. And so we will discuss what is covered in depth and the main information that you need to know. And I just want you to, the big thing is with this class is it's a lot of information, but I'm going to reiterate over and over and over again the things that I feel like are important for you to know to help you and your clients give, or to help you give your clients the best care possible in your career and the best information possible in your career. So just keep those things in mind as you're studying, and then we'll move on to the next module.